Hello, everybody. I'm thrilled to be here today to launch our new Facebook program with Dr. Nieca Goldberg. It is called Heart to Heart with Dr. Nieca. For those of you who don't know Dr. Nieca, which is kind of amazing since she's, fabulous, Dr. Nieca Goldberg is the medical director of NYU's Women's Heart Program and a senior advisor, Women's Health Strategy at NYU Langone, and the founder and former medical director of the Joan H. Tisch Center for Women's Health at the NYU Langone. She is an author. She wrote a book called Women Are Not Small Men, still the greatest title of all time, and others. And we're here today to talk about the new show that's launching bi-monthly, which is every other week, but it will be next week. We'll talk about that again, to talk about women's health. My name is Meryl Moss, and I am the president of Meryl Moss Media and publisher of Booktrib.com. Welcome, everybody. Welcome, Dr. Goldberg. Welcome, Dr. Nieca. It's thrilling to have you here today.
Great to be with you, Meryl.
I'm so excited. We are launching early the American Heart Month, which is every February, but we're not waiting till February because it's too important for women to know about their hearts. And Nieca, I'd like you to talk about, Go Red, because some of our women may know about Go Red, but anybody who is a mother, a daughter, a sister, or a friend has to know how their heart behaves differently than a man's heart, right? They need to know that. And Go Red started 16 years ago, and we have a whole new group of women that we need to talk to and tell. So please tell us.
The Go Red for Women campaign started about 16 years ago in 2004, so nearly 17 years ago. And that was after a couple of years after my first book was published, Women Are Not Small Men, raising awareness on heart health for women. And the goal of the program was to raise awareness so that women would be driven into action to take care of their hearts. And it has been successful. And the way we've known that it's been successful is that the American Heart Association developed programs that women could do online, and it took off. But we found out that right now, when we look back on the women who are most aware and least aware about heart disease as their leading health threat, we learned that women over the age of 50 are more likely to realize heart disease is a big health issue for them, but the younger women are not. And that makes sense because the program started in 2004. And, and the women have gotten older. And one of my biggest concerns now is that there was a survey done late last year that showed there has been a 20% in reduction in heart disease risk awareness amongst women over the last 10 years.
We have to start again.
We have to start again, and we have to figure out how we can encourage more women to take these messages into their own personal health program.
Would you tell our viewers here today a little bit about that when you were in medical school, how they didn't even teach that women were getting heart attacks?
That's true, because most of medical research was done on men, and except for pregnancy and childbirth, they used the results on men for women. And women often were kept out of research trials because there was concern about, especially for medications and things in women of childbearing age, should they become pregnant and not knowing whether these things can affect the baby. And things have really changed. There has been increased participation required in trials that are sponsored by the NIH and other organizations, and to make sure those research trials are diverse. So it's not just a woman being involved, but women from all different backgrounds being involved. in the trials so we can best help people with our knowledge. And I remember that in my first job, that's where I met a woman who I was making rounds, and the woman was admitted to the hospital, and she told the story that she'd been to a series of several doctors, and with symptoms of tightness in her throat and breathlessness. And the doctors told her anything from the fact that she's stressed out, she should take a vacation. Someone gave her a prescription for tranquilizers, but then she called another doctor and recommended she come to the hospital. And luckily for her, we did blood tests and she didn't have a heart attack. And I was running a stress test lab at that time. And they ordered a stress test for her to walk on a treadmill when we monitored her EKG. And, you know, she didn't go very long on the stress test before she had the symptoms and her electrocardiogram was abnormal. So we stopped the test, and then I had to convince her doctor that she had heart disease. And her doctor actually said something to me that was mind-blowing at the time. And he said, well, you know, she can't have heart disease. She's a woman. And, you know, the nurse working with me actually joined my soapbox, so to speak, and helped me convince him. And she went for an additional test, which was more invasive than walking on a treadmill. It was called a coronary angiogram, where they insert a wire in the groin or through the wrist and advance it to the heart and inject contrast or dye, so you can opacify the arteries that supply the heart muscle. And she had a 99% blockage in the artery that was feeding the front part of her heart muscle, or 95% blockage rather. And so they opened that up and she was feeling much better. But I think it was early in my journey to raise awareness on women and heart disease. And that journey, the hardest part of the journey was not finding women who had heart symptoms, but actually convincing my colleagues that this was an issue.
Something you do even today, I'm sure.
I think it's gotten better, but sometimes we have to, when there's a lapse, because certainly there's far more research out there that is dedicated to cardiovascular issues in women than ever before. And there's more that's continuing to be done. And we have to make sure that that research gets translated into the best clinical care for women.
Can you tell us a little bit about the symptoms that women might not be aware of that could be heart disease?
Sure. Everybody is familiar with what we call the Hollywood heart attack, where there's the crushing tightness or pressure in the chest. It radiates down the arm, up the neck to the jaw. You may break out into a sweat, but sometimes women don't get all of those. They might have the tightness or pressure in the chest, and sometimes it's lower in the chest. It doesn't always have to be on the left. It can be on the right, and it can be lower down in the chest. And particularly for women who have it lower down in the chest, the first thing they think is acid reflux. And, you know, we really need to raise awareness that even when people get chest discomfort, it doesn't have to necessarily be on the side of the heart. The other thing is shortness of breath, the sudden onset of breathlessness, where someone feels as though they've run a marathon, but they haven't done any exercise at all, particularly when these symptoms wake you up from your sleep, like the tightness in the chest or the shortness of breath or occur at rest. Those are pretty bad. And furthermore, women can report upper back pressure, and they can actually faint.
So it's very serious, and women should be aware of these different symptoms so that if they have something like that, they take it seriously.
Yeah, but I want to really point out the leading heart symptom in both men and women is chest tightness. So I want to make sure that men and women know all the symptoms, because you never know who you may be helping and encouraging to call 911 and go to the hospital.
Speaking of, sort of telling somebody and talking about how you're feeling. Can we talk a little bit about telemedicine and how important that is and how valuable in some ways it can be? I mean, it doesn't take the place of meeting with your doctor. We'll talk a little bit about that.
I think telemedicine is a really important tool. And we found out about telemedicine and it became more widespread because it was a necessity because of the COVID-19 pandemic and how we were sorting out how to deliver healthcare for things other than COVID-19 during the height of the pandemic here in New York City. I know that people are experiencing pretty high numbers in other states right now. And I think that telemedicine was a great addition to our toolbox because particularly for people who need a check-in, who are stable, not having active heart symptoms, for their blood pressure, to check in on how they're tolerating their medicines. If somebody has a physical finding that you can actually see, like swelling in the legs, or during my physical exam, you can tell if somebody's short of breath, if they're able to complete a sentence, or they can do a sentence without coughing, and they don't appear breathless. So you actually can do a pretty decent exam, except for the fact that right now we're not able to listen to someone's heart or do an electrocardiogram. And you know what? During the pandemic, when everyone was home alone, it was a nice way to connect with my patients. For a short period of time, they had someone visiting with them, and they were really quite excited about the experience.
So something they might not have gotten into before, out of necessity, they started doing this technology and really embracing it. I think we all have embraced Zoom.
We all have embraced Zoom. And you also use telemedicine visits, since there are a number of women who have healthcare outside of New York State and live far away from the office, but they want to have my opinion about their medical testing and stuff. That has been a way that I could help those women if they send all of their medical records and then meet them on a video visit. I also want to say, particularly in cardiology or general medicine visit, sometimes it's actually the video visit or the telemedicine visit requires patient participation, meaning that it's good if you weigh yourself before the visit so you can give that information to your doctor. If you have a home blood pressure machine, you can get your blood pressure taken. And certainly a smartwatch, Fitbit, you have your heart rate. So we get a lot of those vital signs that we get in the office.
Yeah, I was just about to ask which new technologies really help a telemedicine visit, and you mentioned the ones that, are there others?
One of my patients has an Apple Watch, and she scheduled a visit, and she was able to send me an electrocardiogram
Wow.
from her watch. And then there are people who have an app called the Cardia app. It's often used to detect atrial fibrillation, and the patients can upload the electrocardiogram to the medical record system, and I can see it. So we're actually using this technology to really improve healthcare.
That's great news. That's great news for everybody. Speaking of COVID-19 and having a visit to your doctor, can you talk a little bit about how, in your particular hospital, they're really taking great care and how they're handling patients that are not COVID-19? How's that working?
Early on in the pandemic, our health, NYU Langone Health, really increased the usage of what we call virtual urgent care visits. And our virtual urgent care visits are manned by ER doctors. And for particularly people who are calling in with the symptoms of cough, shortness of breath, fever, loss of a sense of smell or taste, those people were immediately triaged to virtual urgent care. So at that point, they would not have to come to the office. So those patients would not come to the usual doctor's office. And those ER doctors were able to triage those people who could be treated at home versus people who needed to come to the emergency room.
Mm-hmm.
So I thought that was a great technology to use and really helps in terms of keeping people safe.
Can you're still going to the office, the hospital, several times a week?
Well, and when we closed down in mid-March, we did predominantly virtual visits, telemedicine visits, and Colleen, my nurse practitioner, and I went in once a week. And because our hospital system also organized that the offices only had one doctor at a time and exam rooms available so that nobody waited in the waiting room. They were really strict about social distancing. Also, before people come for their routine visits, even now in June, we started our regular schedule. So I see patients every day except Thursday.
Mm-hmm.
And they really call people up to ask them questions about whether they're having symptoms or fever. And we triage people. Also, people get COVID testing. For instance, when I refer a patient for a stress test, that patient has to have a COVID test before, or many of the cardiac tests, and even if they need surgery. But our health system is opened and we do it safely. I wear a mask and a visor. So everybody has been given the PPE and we use it.
It's great news. We've certainly come a long way in all these months.
Yes.
We have a little bit of time left, and I think it's good for people to think now that we're into January and it's the new year, new you concept of how we put our best feet forward in thinking about our health. Can you talk a little bit about the best way to watch your, maybe the three things to do this year to be healthy?
Well, everybody has gotten into their own cooking during the pandemic because we're not eating out as much. And in my own practice, I see a lot of my patients have lost weight because they're eating more at home. But some of other people I see, they started to drink more alcohol and, they have Zoom parties. And having a party is great, especially if you're social distance, but you have to watch how much you're drinking. And for women, it's up to 1 glass, for men up to 2 a day of wine. And then the others who are baking sourdough bread and eating it. So I want to point out the diet of 2021, the best diet of 2021 is the Mediterranean style diet, which has been the best diet forever. It's low in meats and sweets. It's a lot of fresh vegetables, whole grains. And in terms of using oils, it's the omega-3s from fish and using olive or canola oil when you're preparing things. And the Mediterranean diet is one of the only diets that is shown to reduce heart disease risk. So I think that's one of my top recommendations is to check this out because there's a lot of variety in it. And if you're into trying new recipes, there's a lot of great recipes using the ingredients in the Mediterranean style diet. And we've all learned and found that it's doable to exercise. Exercising at home spin bicycles, online exercise classes, strength training, Pilates. I think there's a lot of ways you can exercise even when you're at home and can't go to the gym. So you need to continue exercising. And last but not least, for those people who are smoking, you need to find a way to quit. And one of the greatest things that happened yesterday was one of my patients. I put her on a medicine to quit smoking. It's a Wellbutrin or Zyban. And she told me that was the best thing anyone ever did for her.
Wow, that's great news. Getting off of cigarettes is very, very important.
This
is the year. If you haven't done it yet, this is the year to do it. Great. Can
So I
you?
look forward to our next Heart to Heart with Dr. Nieca, and we're going to be talking with Tara Parker Pope, the health columnist from the New York Times.
Exactly. So this has been terrific. That is next week, next Thursday, actually, January 14th with at 1 o'clock on Booktrib's Facebook. We'll have Dr. Nieca again with Tara Parker Pope from the New York Times. This has been a great session. We could go on and on talking about women's health, but we're going to cover all kinds of issues that affect women, and we'll be answering questions as well. So thanks so much for coming. And you know what? You can in our Facebook feed, if you'd like to put in any questions that you'd like to have answered or topics that you'd like to have covered, we'd be interested in getting that as well from our audience. Thank you so much. Have a heart healthy day.
That's right.